Strange symptoms of colon cancer. Silent signs. You can't ignore. Welcome back, folks. Today, we're embarking on a journey into the realm of health, focusing on a topic that demands our attention: colon cancer. You might be thinking, I'm healthy. This doesn't apply to me. But that's precisely why we need to delve into this subject. Colon cancer often begins without any noticeable symptoms, making it a silent foe that can quietly progress, undetected, until it reaches a more advanced and challenging stage. The key here is early detection, and that's what we're here to talk about today. The strange symptoms of colon cancer that you might not be aware of, signs that your body might be trying to tell you something important. So, whether you're here to gather knowledge for yourself or to share it with someone you care about, stick around. Because when it comes to health, knowledge truly is the best armor we can equip ourselves with. Get ready to unravel the mysteries of colon cancer and empower yourself with the information that could make all the difference. How to identify early symptoms of colon cancer. Now that we understand the importance of early detection, let's delve into how you can identify the subtle yet crucial early symptoms of colon cancer. Because here's the thing, when it comes to this particular adversary, catching it early can significantly widen the spectrum of treatment options and improve the chances of survival. Colon cancer is notorious for its ability to remain inconspicuous in its early stages. You might be wondering, what should I be looking for? Well, let's break it down. Local symptoms. The early local symptoms are like whispers from your colon, signaling that something might be amiss. These symptoms primarily affect the colon, also known as the large bowel. Keep a keen eye on 1. Constipation and/or diarrhea. Changes in your bowel habits, whether it's constipation, diarrhea, or alternating between the two, can be indicative. 2. Rectal bleeding. One of the hallmark signs. If you notice bright or dark red blood during bowel movements, it's time to pay attention. 3. Blood in the stool. Keep an eye on your stool. If it appears bright red or dark red, it could be a red flag. 4. Abdominal pain. Persistent abdominal pain, especially if it's unusual for you, should not be ignored. It's essential to note that these symptoms can also be associated with other conditions. However, the key is consistency and paying attention to any persistent changes in your bathroom habits or abdominal discomfort. Systemic symptoms. Beyond the colon, colon cancer can manifest in systemic symptoms that affect your entire body. These are broader signs that might not immediately scream colon cancer, but they're essential warning signals. 1. Loss of appetite. If you find yourself losing interest in food without any apparent reason, take note. 2. Unexplained weight loss. Significant weight loss without changes in diet or exercise can be a red flag. 3. Nausea and vomiting. Persistent nausea and vomiting, especially if unrelated to any other known conditions, should be investigated. 4. Anemia. Not having enough healthy red blood cells can result in fatigue, weakness, and shortness of breath. Rare symptoms. Let's talk about some of the rarer symptoms that might raise an eyebrow. 1. Sharp abdominal pain. If you're experiencing sharp, persistent abdominal pain, it's worth investigating. 2. Continuous fatigue. Fatigue that doesn't improve with rest could be an indicator. 3. Iron deficiency. Anemia. Even with treatment, if your anemia persists, it's time to dig deeper. 4. Gradual weight loss. A gradual, unexplained weight loss that doesn't seem tied to lifestyle changes is a cause for concern. Remember, your body has its own language, and it's trying to communicate with you. Understanding these early symptoms and being proactive can be the first line of defense against colon cancer. Don't ignore the whispers. Listen, and take action when needed. Stay tuned as we unravel more about this critical topic. Risk factors of colon cancer. Colon cancer doesn't discriminate, but certain factors can elevate your risk. Let's break them down. Age. One of the most significant risk factors is age. As you grow older, the likelihood of developing colon cancer increases. Inflammatory bowel disease, IBD. Individuals who have been grappling with inflammatory bowel diseases, such as Crohn's disease or ulcerative colitis, for 8 years or longer face a higher risk. Family history. If a first-degree relative, parent, sibling, or child has had colon cancer, your risk is higher. It underscores the importance of understanding your family's health history. Genetic syndromes. Certain genetic syndromes, such as familial adenomatous polyposis or Lynch syndrome, can significantly heighten your risk of developing bowel cancer. It's essential to recognize that while these factors contribute, they don't guarantee that you will develop colon cancer. On the flip side, even without these risk factors, it's still possible to develop the condition. Types of colon cancer. We've covered the early symptoms and risk factors of colon cancer. Let's dive deeper into the different types of colon cancer. Understanding these variations is essential for tailoring effective treatment plans. The most common type of colon cancer is adenocarcinoma, constituting a whopping 95% of colorectal cancers. It originates in the lining of the large intestine. Adenocarcinomas often start as polyps, finger-like growths of tissue. The beauty here lies in early detection. If caught at the polyp stage during a routine colonoscopy, they can be removed before evolving into cancer. But adenocarcinoma is just the tip of the iceberg. Let's explore some other, less common types of colon cancer. Gastrointestinal stromal tumors, GISTs. These rare tumors can occur in the gastrointestinal tract, including the colon. Lymphoma. Though more commonly associated with the lymphatic system, lymphomas can also develop in the colon. Carcinoids. These slow-growing tumors might not always cause symptoms, making them challenging to detect. Turcot syndrome, a genetic condition that predisposes individuals to develop tumors in the colon and the central nervous system. Peutz-Jeghers syndrome, PJS. Another genetic syndrome characterized by the development of polyps in the digestive tract, including the colon. Familial colorectal cancer, FCC. This type involves a family history of colorectal cancer, but doesn't fall into a specific genetic syndrome. Juvenile polyposis. Coli, a rare condition where individuals develop numerous polyps in the gastrointestinal tract. Diagnosis of colon cancer. We've journeyed through the types of colon cancer. Let's explore how medical professionals diagnose this complex condition. Early and accurate diagnosis is the cornerstone of effective treatment. When there's suspicion of colon cancer, your healthcare provider may recommend a series of tests and procedures to confirm the diagnosis. Let's break down these steps. Colonoscopy. This procedure is the primary tool for diagnosing colon cancer. A thin tube with a camera at the tip is inserted into the colon to check for abnormalities. If polyps are detected, they can often be removed during the colonoscopy. Some individuals may feel uneasy about the idea of a colonoscopy, but it's essential to understand that the procedure is conducted under general anesthesia. This means it's not painful, and it's highly valuable for both diagnosis and prevention. Biopsy. If abnormalities are identified during a colonoscopy, a biopsy may be performed. This involves removing a small piece of tissue from the suspicious area, which is then sent to the lab image testing. In some cases, additional imaging tests like a CT scan may be recommended. These tests can help determine if cancer has spread beyond the colon and pinpoint the location of tumors. Gene tests. During a biopsy, tissue cells can be tested for specific genes or proteins. This information is crucial for determining the most effective course of treatment. If a gastroenterologist confirms a diagnosis of colon cancer, the next step is to establish a personalized course of treatment. Treatment and prevention. For now, it's crucial to understand that the diagnostic journey involves a collaborative effort between you, your healthcare provider, and specialists to ensure a comprehensive understanding of your condition. Common treatment options for colon cancer include 1. Surgery. This is often the primary treatment, involving the removal of the cancerous part of the colon. In some cases, nearby lymph nodes may also be removed. 2. Ablation or embolization. These techniques involve destroying or blocking blood vessels feeding the cancerous growth. 3. Radiation therapy. High-energy rays are used to target and destroy cancer cells. It's often employed before surgery to shrink tumors or after surgery to eliminate any remaining cancer cells. 4. Chemotherapy. Powerful drugs are administered to kill cancer cells or prevent their growth. It can be used before or after surgery, or in cases where surgery isn't an immediate option. 5. Targeted therapy. This involves medications that specifically target certain molecules involved in cancer growth. 6. Immunotherapy. This treatment boosts the body's immune system to fight cancer cells more effectively. The specific combination of these treatments depends on the individual case. Your healthcare team will design a personalized plan tailored to your needs. Let's shift our focus to prevention, a crucial aspect of managing colon cancer risk. Key prevention measures include healthy lifestyle, engaging in regular physical activity, maintaining a balanced diet rich in fiber, fruits, and vegetables, and avoiding excessive alcohol consumption and tobacco use. Regular screenings. Timely screenings are highly recommended, especially for individuals aged 45 and older. Both the American Cancer Society and the U.S. Preventive Services Task Force stress the importance of regular screenings. Prevention is about being proactive. If you have risk factors, don't wait for symptoms. Regular screenings can catch potential issues early, increasing the chances of successful treatment. Remember, your health is a journey, not a destination. The information shared today serves as a compass, guiding you towards a deeper understanding of colon cancer. Armed with this knowledge, you possess the tools to listen to your body's whispers, recognize potential warning signs, and take decisive action when needed. In the grand tapestry of health, prevention is a thread that weaves through every chapter. By adopting a healthy lifestyle and embracing regular screenings, you are actively participating in your well-being. Colon cancer, like any adversary, is best faced head-on, armed with awareness and a commitment to proactive care. If you're watching this with a loved one or a friend, consider sharing this knowledge. Empower those around you with the information that could make a difference in their lives. Together, we can create a community that values health, prioritizes prevention, and supports one another on this journey. Thank you for joining us on this exploration into colon cancer. Stay informed, stay proactive, and most importantly, stay healthy. Until next time, take care.